Recently, there has been an increase of appliances which clip onto the teeth to help align them. These are usually transparent and are hardly visible, and naturally, patients prefer to have their teeth done by this method, as very little shows. However, they have quite severe restrictions. They are unable to move the teeth very much at any one time. And with some of them, they have a series of appliances which you fit every few months. And then the teeth gradually move a bit more, and then you fit another one. These all evolve from a system that I was familiar with back in the 1940s and 1950s, where they used a rather thick rubber mold that you bit into to help to move the teeth into their right position. However, the modern ones are far more sophisticated, and many of them are made with electronic impressions and processed in laboratories. Others are made by casting the models in plaster and then cutting the teeth on the model off and repositioning them a little, and then making an appliance that fits them in that position, so that when you put them in your mouth, it moves them just that little bit to the position that you wish. Broadly speaking, all these appliances can only tackle relatively mild irregularities of the teeth. They're not able to cope with severe ones. They work much better on cases where no extractions are needed, because they are not very good at opening and closing spaces. They primarily change the alignment of the teeth, and when necessary, give them a slight rotation. They also have their limitations in correcting patients who have a deep bite where the teeth overlap a lot, or an open bite where the teeth are apart. They also have a limited value when the teeth are set back, and a very limited value when the teeth are set forward. So, by and large, they have their place for mild malocclusions, particularly if patients do not want any appliance to show. But it is a strictly limited use that they have, and one, of course, needs to remember that whatever the corrections they achieve, there is an almost inevitable tendency for the teeth to relapse back to where they were. And so the appliances are probably necessary for the rest of your life, or at least as long as you want your teeth straight.